Dear Volker, thank you for invitation and the opportunity to once again speak about registry. You ask me whether registries are still a challenge. The answer is a clear yes, but the challenge is a totally different one. The last time you have invited me to your brilliant congress was in the year 2015. At that time, my main task and purpose was to convince you, the audience, physicians and surgeons about the necessity to use registries. And this was nearly impossible. The majority of physicians just were not interested or even annoyed. Talks on congresses not seldom ended up in a wrangle. And in case you were convinced and tried to participate in a registry, the settings in your hospital, like IT, were so bad and your staff so reluctant that plenty gave up, or data input was too bad for appropriate quality. Now, only 6 years later, everything is absolutely different. There's no discussion about the need for registries anymore. To the contrary, there's an explosion of activity at various levels like medical societies, industry, and politics. The SIMEG definitely is part of the new challenge. So, what happened in the meantime? In the last years, actually decades, we have a long list of implant scandals in all fields of medicine. Not all of these scandals became public. In spine surgery, for example, the masses of IPD implantations or lumbar disc prostheses. This was possible because of a very weak regulation of medical products, the so-called Medical Device Directive, MDD. In Europe, one could invent a device, put a CE certification on it, and then implant it in thousands or 100,000s of patients without any need of control. No tracing, no study, no registry, nothing. To crown it all, we know that studies with a bad outcome of an implant were rarely published. But one scandal of all these other scandals was special. The poly-implant prosthesis PIP scandal. Cheap industrial cancerogenic silicon was used for breast implants. This actually is a crime. The scandal was that nobody knew in whom these cancerogenic bombs were implanted. Anyhow, this was somehow too much for our European parliamentarians. After all these more or less public implant scandals, the breast implant scandal had the power to change things. In the year 2017, the former Medical Device Directive was replaced by the new and very strong, for the taste of some too strong, Medical Device Regulation, MDR. It says, for each device, manufacturers shall plan, establish, document, implement, maintain, and update a post-market surveillance system. It also says, the post-market surveillance system shall be suited to actively and systematically gathering, recording, and analyzing relevant data on the quality, performance, and safety of a device throughout its entire lifetime. What do you think which is the only tool able to accomplish these requirements? No doubt, only registries can. It took another 2 years until a corresponding law got through the German Bundestag. MDR and the subsequent national implementation changed the awareness of registries. From that time, everything was different, but not less challenging. For example, the development of the German spine registry. It has a 10-year jubilee. 20 years ago, the International Spine Registry, Spine Tango, was founded with a subsequent German module. 10 years ago, the German Spine Society, DWG, separated with a known registry, the German Spine Registry. From 2001 to 2017, things happened, but it was more or less persuading. With the MDR in 2017, no persuading has to be done anymore, but we in the committee of the German Spine Registry had an explosion of meetings and talks to health ministry, political institutions like Dptmt, other societies, health insurances, and of course very intensively with the industry. The Dptmt, as the political institution which has been chosen to establish the implant registry in Germany, had already quite concrete suggestions about its registry. Therefore, the DWG convened an ad hoc committee to set up a new German spine registry with the aim to be compatible to the implant registry Germany. After almost 2 years, this job was done, and we had the structure for a very complex and detailed registry, with an obligate basis module and optional science modules. Together with the industry, we also structured a product database for both the German Spine Registry, the new German Spine Registry, and the product database. The German Spine Society negotiates with providers. Technically, the data collecting must take place by interfaces between hospital information system and registry, because the manual input of the data would be much too time-consuming. I give you some examples for new challenges in open crucial questions. The implant registry is regulated by law. This gives new power to the landscape of registries, but political decisions take the time and are seldomly straight from the beginning. Here one can see the German authority model from March 2019, which already had some changes and probably will have further changes. The National Registry tried to adapt and form the registry so that they are compatible to the implant registry Germany. This is necessary for possible data transfer, which we can perform at the time our society by law has to use the implant registry. This may happen in about 5 years. The time we enter data manually hopefully soon will be over. In the future, our registries will sample big data. And because no one is willing and able to do this by hand, interfaces to the hospital information systems are mandatory. An implant registry needs the input of implant data. Therefore, we need a major implant database. For both the big data registry and the implant database, our society needs a professional provider. We must respect ethic questions and look after data protection. How to finance the new spine registry. Implant data are valuable because industry has to fulfill MDR and notified bodies will demand on it. The society sells the data to the industry and therefore can afford its registry. Shall we as the German Spine Society perform our registry as a national solo effort, or shall we seek for international cooperations? Advantages and disadvantages must be discussed. A very important but difficult challenge is the patient tracing. A patient after a failed surgery in one hospital changes the location for the revision. In the present registry, the same patient becomes 2 cases. This must be different with the next registry. Beside of all these challenges I have mentioned, I believe we as scientists have to face a complete new political and public threat. Some refuse scientific facts and rather like to believe whatever they hear and whatever fits in their belief. There's a lot of disinformation, and we have a rising number of politicians ridiculing science and facts. Quite interesting what this is leading to. This last slide is for remembering you that a registry has plenty of advantages and that it is worth to establish and use them. Registries are good for effectiveness research, post-market surveillance of implants and therapies, quality, safety assurance and care providers, interventions and implants, cost effectiveness analysis, detecting rare events, long-term result of therapies, and earning money. I finish with the words of Ernest Emery Cotman, who was born 1869 in Boston. He was the pioneer of public health, the first American doctor who systematically followed all his patients. And he also was the founder of the outcome management. Thank you very much.